The University of Pretoria's community-oriented substance use program, together with the Drug and Substance Abuse Unit at the City of Tshwane and the South African Network of People Who Use Drugs, held a virtual research symposium focusing on the work done in and around substance use in the City of Tshwane. According to the Treatment Demand and Harm Reduction Service data, the number of people who sought treatment has increased quite significantly from January to June of this year. Alcohol, cannabis and heroin has been identified as primary substances used by people seeking treatment for problematic use in the city. For more insight on how these challenges manifest, we're now joined by researcher in the Department of Family Medicine at the University of Pretoria, Dr. Andrew Scheibe. Dr. Scheibe, a very good evening to you. Thank you so much for joining us. Welcome to The Globe.
Thank you. Good to be here.
From the data that has been collated already, just how prevalent is the issue of substance abuse, especially in the City of Tshwane?
So that's a good question. Because of the illegal nature of drug use and stigma discrimination, it's very difficult to get a real good sense of how many people use drugs. What we do know is that many more people use than we're aware. And what we see from the treatment data is that as the COVID pandemic has gone through different waves, people have needed to access more care and treatment. We know that the people who access treatment is just the tip of the iceberg. And I think in Tshwane, like other cities, everyone in everyone's family knows someone that's trying to manage with harmful substance use.
Is this substance abuse driven by socio-economic issues, or is it simply peer pressure, in particular within the younger community?
It's one of those typical things where we don't have a very good, clear, simple answer, but definitely the psycho-social circumstances that people are finding them in current South Africa is a major contributing factor to substance use, particularly poverty, lack of economic opportunity, lack of education, lack of a sense of hope. All of those really contribute to people's use of substances. In addition, there are people who have mental health conditions or physical health conditions that aren't well managed, and that also contributes to use. So it is true that among some adolescents, there is peer pressure and more easy access to substances at the moment. But generally, it's those larger issues that face people that are really the most important issues and the hardest to address. It's not the drugs or the substances themselves that cause the most reasons for people using. In as much as
drug and substance abuse is quite prevalent here in South Africa, not just in the City of Tshwane, but generally, across the board. But we've seen a significant increase in drug and substance abuse between January and June this year, and the figures are quite alarming. I mean, we've seen an increase to 5,969 from 4,912 of the previous period from June to December. What would you attribute this significant jump?
Yes, so that information is mostly from centres that are part of what we call the South African Community Epidemiology Network, and it's just the treatment centres in Gauteng. It includes those treatment centres that provide outpatient service, as well as those that include inpatient service. And unfortunately, during the height of COVID last year, many of the services were interrupted. So while there might not be more beds available now, it's just that it's now easier for people to during that time to be able to move and to access care. But in addition, because of the stress of COVID and the kind of desire for many more people to want to access care has contributed, we think, to that uptake in service and service demand. I think the important thing to note is there's still a great unmet need. There are tens of thousands of people who need treatment and either aren't aware of it, can't afford it, where there is a cost involved, or there aren't spaces for them to access care, at least evidence-based care.
Well, the United Nations Office on Drugs and Crime has now projected the number of people who use drugs to increase by 38% by the year 2030. Is this an indictment on the anti-drug abuse organizations and associations, or is it simply the fact that people do not want to leave drugs, do not want to, abide by the warnings by such anti-drug organizations?
So the science is very clear that the war on drugs and arresting people and putting people into prison really causes a lot more harm than it does good. And over the 20 or 30 years that approach has been taken globally, it's been at huge expense with a lot of consequences for individuals and for communities. So the philosophy that thinks that warning people about drugs or arresting people of drugs is an approach that works, it's not true. We know, as mentioned earlier, people use drugs for a range of reasons, and the most pressing things are factors that are not related to the drug themselves. It's all of those socioeconomic factors that are so important. And in the African setting, why those numbers are so large, it's because we have such a young growing population. And from a drug use prevention component, what the research shows globally, if we do believe in using evidence to inform our responses, is really the most important thing is supporting early childhood education, keeping children within school, building social competencies, building people's literacy and numeracy skills, and their skills to navigate life. And that actually provides people the protection that they need to help mitigate potential use of drugs or developing a drug dependency, or in the minimum, it delays the onset of drug use. And I think it's just why Africa's in this situation is because we've got this booming population, and also it's only in the last 20 years or so that many of the illicit drugs, particularly heroin and methamphetamine, have been transiting through our continent. But they no longer just pass through. We have well-established drug markets locally. And as a result, we have to look to countries that have used evidence-based approaches to address this phenomenon.
Do you get a sense that the people who misuse alcohol often seek help when they've reached alcohol dependent stage, which is much later in life? Do you think there's that appetite to seek help upon acknowledging that they have a problem?
So what makes alcohol different from other more illegal drugs is the fact that there's such a social norm around heavy, harmful alcohol use. And as a result, there's a normalization of the development of people could call it alcoholism, but a dependence on alcohol. And often it's only very late in a person's alcohol use history that they reach a stage where they actually go and seek treatment. And because alcohol is so widely available, its use is so normalized, it's one of the most hard substance use disorders to treat. And it is encouraging that people recognize when they do have an alcohol use problem to try and access services. But it's more around the fact that there are many people with alcohol use disorders who are in their 20s and 30s. They just have not acknowledged the fact and so have not yet accessed care.
And I suppose one issue or one area that has been widely shunned, or an area that we've ostensibly turned our backs on, is the issue of the link between drug abuse and HIV. Because the data that I have here, I mean, the percentage of those presenting for treatment that has been tested for HIV in the past months was 57%, with at least 8% refusing, to acknowledge that they have a problem. So, do you think that much is being done in terms of raising awareness of the link between drug abuse and chronic disease such as HIV and AIDS?
So it's not just only HIV, it's also tuberculosis and also viral hepatitis.
Yeah.
And as mentioned earlier, it's not the drug itself. It's often the fact that drug use is criminalized in South Africa, and that puts people at a lot of risk. Because people don't have access to safe places to use drugs, people don't have access to sterile injecting equipment, and they have to reuse or use contaminated injecting equipment. That is the major risk factor for HIV and viral hepatitis. People being arrested and ending up in prison is also a contributing factor to tuberculosis. The high risk of overdose is if people don't have access to harm reduction information. So there are a lot of risks associated with drug use, and one of the challenges is that people often have a lot of myths around drugs, and don't actually have access to accurate information and also harm reduction services. And we know that where harm reduction services are in place and they're at scale and they reach the World Health Organization targets, they can have a significant impact on reducing HIV and viral hepatitis infections. Encouragingly, our local policy is supportive of harm reduction, and the City of Tshwane is the one municipality that is funding harm reduction. And so it's funding the largest opioid substitution therapy program for people with opioid dependence, and also a large needle and syringe service. And those are the services that are particularly designed to prevent HIV and viral hepatitis and really improve people's access to general health care more broadly, without stigmatizing and without focusing on criminalizing people and supporting people really to achieve health.
Let's talk about the community-based approach to harmful substance abuse and the likelihood or the possibility of it being integrated into the existing primary healthcare model. Does the country's authorities, the health authorities in particular, have much capacity to integrate, the harm reduction model into its existing, healthcare?
So I think definitely our health system is moving to what we call primary healthcare reengineering, which is really focusing on providing basic care to people close to where they live. And the science shows that if you are able to provide support early, you can prevent many of the long-term consequences that happen with chronic conditions. And we are doing that very well with HIV, improvingly so with TB. And in Pretoria, we've shown that it is possible to quite easily integrate drug treatment and drug screening as part of the work that community healthcare workers do. And it's important to note that these brief interventions that are based on an evidence-based approach of screening are very effective to reduce people's risk for drugs, because it also includes information on the risks, key messages on how to cut down, and then identifying people that have the need for ongoing referral. So it still requires scale up and needs to be continued within Gauteng, within the City of Tshwane, and also it's a methodology that's based on community-oriented primary care, which has proven to work very well and needs to be scaled up further. And the investment in these interventions that are proven to work are much better and save money than waiting till people have serious conditions, and it's much less expensive than actually putting people into prison. Prison is very expensive. It actually increases the likelihood of people being involved in organized crime. People often with a criminal record are more likely to return into the prison system. So it's really an expensive, ineffective approach to managing drug use specifically. And so those community-based health approaches save money, save lives, and really work.
All right, Dr. Andrew Scheibe, lovely chatting to you, sir. Thank you so much for joining us.
Thank you.